Page 1. Cover picture. The photograph shows an older man with short white hair sitting outside in his garden. He is smiling and looking slightly upwards towards his left. He is gently cradling a small, brown, wrinkly-faced dog in his lap, with another small brown dog by his feet. The top right corner displays 80 years young, established 1945. Along the bottom of the image, also on a dark blue background, is the text, "Improving the quality of later life," and "Our Impact 2023 to 2024," followed by a numbered chapter grid with the number 1 in green. Page 2. Our mission. The mission statement reads, "We want Norwich to be an age-friendly and inclusive city. This is more important than ever with our ageing population." The We Help By section lists 5 key areas of action, each accompanied by a relevant icon. Number 1. Targeting and tackling inequalities that reduce life expectancy and quality of life. Number 2. Being a champion for people over 50, listening and responding to the voices of residents and championing their cause to make improvements and maintain quality services. Number 3. Providing support and opportunities that enable people to live healthy and connected lives. Number 4. Advocating the use of age-friendly design principles, promoting the World Health Organization age-friendly principles in the design of city, county and service environments, working on things like transport, housing and community support. Number 5. Read our story so far at www.agefriendlynorwich.org. To the right of the Our Mission heading is the Age Friendly Norwich logo. At the bottom left of the document is the text Our Impact 2023 to 2024. On the bottom right is also the logo for Centre of Aging Better with the tagline, "Action today for all our tomorrows." Page 3. Quote. The quote is enclosed in large stylized quotation marks at the beginning and the end. The text of the quote reads, "Maximising the health and therefore the life chances of older adults should be seen as a major national priority, and one where we can make significant progress often with relatively straightforward interventions." Below the quote, the attribution reads, "Professor Chris Whitty," followed by Chief Medical Officer on the next line. Page 4. Overview. This page presents key statistics. The top left section with a pink background shows we secured over £2.8 million for our clients, helping them face the cost of living crisis. This is followed by a stack of coin icon. The top right section with a light blue background shows us we increased our reach by 31% in Norwich's areas of deprivation. This is accompanied by a percentage symbol inside a house icon with an upward pointing arrow. The middle left section with a light blue background and a telephone icon states 3,027 befriending calls were made. The middle right section with a light green background and an icon of hands supporting a heart indicates 9,209 community welfare checks or interventions were made. The bottom left section with a light pink background contains text that reads, "We help a wide range of people, their families or professionals who arrange support for others." To the right of this text is a pie chart showing an age breakdown of those supported. Over 80 is 31%, aged 60 to 79 is 50%, and under 60 is 19%. The bottom right section with a light blue background and an envelope icon states, "We handled 18,365 incoming calls, web chats and emails." Page 5. Overview continued. This page displays a bar chart illustrating the welfare benefits and debt reduction achieved over 5 financial years. The chart has the y-axis labelled welfare benefits and debt reduction, with values ranging from 0 to 3 million in increments of 0.5 million. The x-axis represents the year. There are 5 vertical bars, each representing a different financial year. The bar for 2019/20 is pink and reaches a value of 1.4 million. The bar for 2020/21 is dark blue and reaches a value of 1.25 million. The bar for 2021/22 is a light blue and reaches a value of 1.18 million. The bar for 2022/23 is purple and reaches a value of 1.47 million. The bar for 2023/24 is a significantly taller bright blue and reaches a value of 2.87 million. Above the chart reads, "We broke the 2.5 million mark, helping to tackle poverty and the physical/mental health impacts of the cost of living crisis." Below the chart, further text states, "A 5-year return on investment of our advice service showed £1 to £12.62, with NHS saving of 4.12 million over the same period." Page 6. Trustees. This page presents information about the leadership of Age UK Norwich. At the top are 2 circular profile photographs. On the left is a man with short brown hair and a beard, wearing glasses, a light blue patterned shirt and a brown jacket. Below his image is the name Dan Skipper, followed by the title Chief Executive Officer. On the right, a man with short white hair, wearing glasses, a light collared shirt and a grey jacket. He is smiling and looking towards the right. Below his image is the name Alistair Roy, followed by the title Chair of Trustees. Below these images and the titles is text. Age UK Norwich is a charity led by experience, with 90% of its trustees aged 50 plus. A list of the trustees follows: Joanna Hanneman, Vice Chair; Kate Money, Carl Gessner, Anthony Collins, Dr. Sarah Houston, Louise Grinsdale, Peter Kelly, Susan Whitaker, Peggy Hughes, Anna Bennett. Page 7. A message from our Chief Executive Officer and Chair. The page says, "Making Norwich an age-friendly city remains our core mission as a charity. The growing, ageing population in the city and county makes this an imperative. We have been working with Norwich City Council to shape and plan for this, and in October 2024, we formally made our application to the Centre of Aging Better to be part of the World Health Organization initiative, a key milestone we set out to achieve in 2024. All existing services to beneficiaries play an increasing part in the overall objective of making Norwich age-friendly. We became an age-friendly employer in 2023 and will be encouraging and supporting other organisations to make that pledge, sharing our expertise and providing opportunities to engage with our work and residents. Those in later life can contribute significantly to making Norfolk County Council's economic strategy a success. This year has been a tale of extremes. We are proud to have 2 services exemplified in Professor Chris Whitty's Chief Medical Officer report, Health in Ageing Society 2023 and welcomed an NHS England visit accompanied by the Right Honourable Patricia Hewitt, Chair of the Norfolk and Waveney Integrated Care System. We were proud to secure 4 awards from the ICS for our social prescribing partnership with other local charities and technology we embraced for health coaching, obtained by NICE guidance status for falls prevention, avoiding the risk of hospital admission. In partnership, we're driving the development of the later life provider network in the county, and more recently, the Inclusive Norwich Partnership to increase support for residents living with protected characteristics, such as age and disability. Both forums provide simpler access to the VCSE, forging partnerships and supporting system integration. Disappointingly, the environment around us has limited our progress in view of service growth and stability. Following cuts in health coaching and social prescribing contracts, despite the accolades and evidence of their impact. This has meant uncertainty and loss of high-quality staff, impacting us and many of our partnership charities. Overall, the capacity of the accredited advice in Norfolk has seen a reduction. The effect on the beneficiaries will be considerable and will place even more pressure on health and social care, widening already concerning health inequalities in the city and county. Page 8. A message from our Chief Executive Officer and Chair, continued. Due to clinical and other pressures, the statutory body's investments into prevention services, including tackling inequalities, have not attracted funding. The public health agenda needs to be addressed, and the Trustee Board will continue to fight for this just cause. The professionalism of the staff team has been exemplary during these conditions, and Age UK Norwich has continued to deliver high-impact services for our clients across all services. We secured over 2.8 million for our clients, helping them face the cost of living crisis. We increased our reach in Norwich's areas of deprivation by 31%, working in partnership with centres, clubs, churches and employees within the community to reach those most in need. For welfare entitlement and debt support, 51% of our clients came from the most deprived wards, an increase of 15% on the year 2022/23. Unfortunately, increased demand with reduced resources has led to higher waiting lists, and the health and well-being risks impacts this causes residents. Our health coaching service and community support services continue to show significant healthcare outcomes, increasing physical activity levels, mental health, independence, and reducing loneliness. Through these investments, we're rehabilitating people before and after surgery and reducing the adult social care waiting list. We're also screening for frailty risks in the community, reducing preventable injury and hospitalisation, and early need for regulated care. This is crucial. Age UK national analysis found that 28,655 older people died waiting for social care in 2023, and locally Norwich's excess winter mortality continues to rise. We're leading new ways to support our growing ageing population through our partnerships and supporting the development of the ICS. We'll continue to be an active partner to represent our clients and the VCSE sector. The Commission on Health and Prosperity Report 2023 states, the UK is getting poorer and sicker, and the UK dropping from 7th to 23rd in life expectancy at birth. More of our population are living with chronic conditions, impairments and disabilities. We also have a growing ageing population, meaning for all organisations, our employees, volunteers and customers are living with more complex needs. The VCSE sector already delivers preventative and rehabilitative services in the community, providing care and support closer to home and reduces health inequalities. This is the strategy of the NHS, public health and social care, and supports the City Council 2040 vision, a livable city, a connected city, a fairer city. Age UK Norwich and its partners already have excellent interventions and services. This report will focus on our partnerships and how together we're improving the quality of later life, and with greater long-term investment, we can improve the quality of later life for even more of our residents, families and carers. Page 9. Financial activities. This page presents a statement of financial activities for the year ended 31st of March 2024, with the comparative figures for 2023. The table is divided into columns for 2024 showing unrestricted funds, restricted funds and total funds, and a final column for 2023 showing total funds. The first section, Income and Endowments, details various income sources. Donations and legacies amounted to £71,836 in unrestricted funds and £8,039 in restricted funds, totalling in £79,875 for 2024, compared to £30,987 in 2023. Charitable activities generated £445,028 in unrestricted funds and £741,804 in restricted funds, totalling to £1,186,832 for 2024, compared to £903,394 in 2023. Other trading activities brought in £33,343 in unrestricted funds, with no restricted funds, totalling in £33,343 for 2024, compared to £11,036 in 2023. Investment income was £6,134 in unrestricted funds, with no restricted funds, totalling in £6,134 for 2024, compared to £5,302 in 2023. The total income for 2024 was £556,341 in unrestricted funds and £749,843 in restricted funds, resulting in a total of £1,306,184, compared to £950,719 in 2023. The next section, Expenditure, outlines costs. Costs of raising funds were £60,607 in unrestricted funds, with no restricted funds, totalling £60,607 for 2024, compared to £36,943 in 2023. Charitable activities cost £691,824 in unrestricted funds and £807,772 in restricted funds, totalling £1,499,596 for 2024, compared to £1,072,547 in 2023. The total expenditure for 2024 was £752,431 in unrestricted funds and £807,772 in restricted funds, resulting in a total of £1,560,203 compared to £1,109,490 in 2023. Following expenditure is net expenditure before transfer of funds, which was £196,090 for unrestricted funds and £57,929 for restricted funds, totalling in £254,019 for 2024, compared to £158,771 in 2023. Transfers between funds amounted to £27,677 from unrestricted funds to £27,677 in restricted funds, resulting in zero net transfer. Net movement in funds was £223,767 for unrestricted funds and £30,252 for restricted funds, totalling £254,019 for 2024, compared to £158,771 in 2023. The final section, Reconciliation of Funds, shows total funds brought forward were £337,000 in unrestricted funds and £43,279 in restricted funds, totalling in £380,279 at the start of 2024, compared to £539,050 at the start of 2023. Total funds carried forwards were £113,233 in unrestricted funds and £13,027 in restricted funds, totalling £126,260 at the end of 2024, compared to £380,279 at the end of 2023. Below the table, a note explains the statement of financial activities includes all gains and losses recognised in the year, and that all income and expenditure derive from continuing activities. It directs readers to www.ageuknorwich.org.uk/about-us for full accounts. Page 10. Contact details. This page shows the contact information for Age UK Norwich. In the top left, a colourful abstract graphic is visible, featuring curved shapes in shades of green, blue, pink and orange. This is a segment of the Age UK Norwich logo. Below this graphic, the text, "For more information, please visit www.ageuknorwich.org.uk/about-us." Under the heading Contact Us is the phone number 01603 496 333, followed by our email address, inquiries@ageuknorwich.org.uk, followed by another web address, www.laterlifelearning.org.uk. Contact information for the Chief Executive Officer, Dan Skipper, is listed next, with his email showing dan.skipper@ageuknorwich.org.uk.